soon as you step out the door.
And with the temperatures dropping even lower, the risk of frostbite is getting higher. ABC 2 News' Eddie Kadam is working for you tonight. Eddie, as it gets even colder tomorrow morning, keep us on the safe side, will you? What can we do?
Well, it just takes temperatures of under 27 degrees for frostbite to set in. And Jamie and Kelly, it's going to be much colder than that the next couple days. So obviously layer up, cover your hands, cover your face. And frostbite can set in 30 minutes with the wind chill, how it's going to be in Baltimore. And in some areas of Maryland, only 10 minutes.
I feel warm enough.
Wrapped up and ready. It's a bone-chilling night in Baltimore. And it's just going to get colder.
The morning is really frigid. Like, I make sure they wear extra clothes under their clothes, their hats and scarves, and definitely the gloves.
The fear of frostbite is real.
My hands started turning low. You know how they turn colors? Yes, sir.
When exposed body parts get cold, the cells inside them freeze. That can cause tissue damage and blood clots.
The first stage that you'll notice will be the part becoming red, swollen, and painful. And then in the later stages, it'll actually become pale, firm, and numb. So noticing the first signs where it becomes a little bit different than just a normal body part that's cold, but really red and swollen and painful.
If you don't get that part of your body warm quick, you may find yourself on a surgeon's table.
Severe frostbite can even lead to amputation. So our goal really is that we don't want your business. I would really be happy not to have any cases of frostbite or have to treat anybody with frostbite this year.
The doctor says most cases can be treated without surgery, but being prepared is your best defense.
What you want to do is you do want to re-warm the part to a normal temperature. You want to do it gradually. You don't want to do it all of a sudden. And importantly, you don't want to re-warm a cold fingertip or a part and then go right back out and get it cold. Because if you go through a number of cycles where the part freezes, thaws out, and then freezes again, that can actually be even worse than just a single episode.
So how do you know when it's time to head to the doctor? Well, if you're getting blisters on your hands and you're putting your hands or wherever may have frostbite and you're putting it at somewhere warm and warming it up and it's not getting any better after a couple minutes, that's usually a good sign. You're going to want to get it checked out. Live in Baltimore, Eddie Kadam, ABC 2 News.